At the Ulster Medical Symposium, you mentioned that we never know where life will take us and that it's okay to not know. And I have to admit, this was kind of comforting to hear because a lot of students, including myself, feel the need to know what classes we're taking in the future or what we're doing right after graduation. And I'm curious to know, how does this aspect of not knowing what's coming next reflect in your own journey in medicine?
Oh my. I really truly believe this, that trying to map out your entire life is an exercise in futility to some point. Certainly it's nice to have 5 or 10-year goals and have an idea of what you like and where you want to head. Absolutely, and I don't want to be dismissive of that at all. But honestly, opportunities become available to you. Your own passions change over time. And I'll give you an example. I was first convinced I was going to be an aeronautical engineer, and then I ended up in medicine. I'm from Ohio, so I was convinced I was going to go to Ohio State for medical school and practice in my hometown in Southern Ohio. But I ended up at Johns Hopkins. A friend had said to me, you should apply. Then at Hopkins, just your notions of what your career is going to be. I loved teaching. I loved seeing patients. So my initial few years on the faculty were spent doing just that, seeing patients on the wards and in clinic and teaching medical students and residents. Around my mid-30s, I discovered this interest in clinical operations. How can we improve how we deliver care? Because I would see the frustrations of my patients, both in the hospital and in the clinic, and I like problem solving, so I had a complete change, a complete career change. Went back and did an MBA and decided I wanted to do clinical operations and be a part of fixing healthcare delivery. And so that started off at age 35 or 36, an entirely new career, which led me to where I am today as the president of the hospital. And who knows, maybe I'll have another career change. But I tell people over and over, please don't become too fixated, because a great opportunity may come your way that you never even considered. You should have an open mind, embrace that opportunity, and see where it leads you.
Along the way then, was there a particular moment when you knew you wanted to be a doctor?
Oh, well, yes. And as I mentioned, as I alluded to a few minutes ago, I loved physics and math and really wanted to be an aeronautical engineer and work for NASA. But, you know, when that life experience happened that made me rethink that. I was a freshman in high school, the oldest of 4 children, and one night after dinner, my parents became very dizzy and nauseated, and they thought there was a gas leak in the house. So they brought all of the children outside, and they kept getting worse, and we were unaffected. Within 15, 20 minutes, my dad is passed out on the bathroom floor. My mom is barely arousable. I'm panicked. You know, I'm the oldest of 4. Call 911. And I remember vividly to this day the paramedics that came to the house doing CPR on my dad. Vividly. And then I remember 2 weeks when they were in intensive care at this little tiny hospital in Southern Ohio in the middle of nowhere, and the doctors and nurses saved their lives. Saved their lives. Now it turns out, you know, fast forward, my parents are fine. They had organophosphate poisoning, which I learned about in medical school. It's from an insecticide that you spray on crops. My dad was a big gardener and had used a very old fertilizer, and there you have it. And it was the first night I remember in a long time that my parents did not make us eat the kale. As kids, we didn't like the kale, and they didn't make us eat it, and thank goodness, because that was the culprit. But this image of what a difference it made in the lives of just this one family, my family, to deliver this life-saving care, just started me thinking, gosh, maybe there's a way to combine science with a more outward-facing, direct help to patients. And I changed. I changed my major my first year in college and decided to do biology and go pre-med with an econ minor.
You've mentioned earlier that you started off as an engineering student and then later switched over to the pre-medical track. What is your favorite memory during those few semesters as a pre-med student?
Oh gosh, yes, pre-med student. You know, of course, we all remember organic chemistry, heaven forbid. And I landed the instructor that was the strictest, but he turned out to be the best. You know, sometimes word on the street is not always true. But some of my favorite memories, there are a couple that come to mind. I spent summers, and remember this was 30 years ago, the opportunities we have today for pre-med students didn't exist, but I worked as an orderly in the hospital, and I transported patients around on their stretchers to and from their tests. And it was so fun to hear their individual stories. But over the course of that summer, it struck me that I could have patients who had the same disease, maybe they'd each had a heart attack, but their experience around how they coped with the heart attack, how they healed, could be very different. And it had to do with other factors in their lives. Did they have a social support network? Or was it a patient who was experiencing homelessness? Did they have money to buy their medications or not? And just, it was fascinating to see how you could take the same disease, but it's experienced very differently by different patients. And that's a side of medicine we often don't think about. But I think, honestly, my favorite memory was when it came time to apply to medical school. And once again, 30 years ago, grew up in a small town, very insulated. Did not come from a worldly family. We don't get on planes. One of my classmates, who was also pre-med at the time, but was taking a year off, said, "Redonda, you have good grades. You should apply somewhere outside of Ohio." And I asked, "Well, where?" And he said, "Johns Hopkins." And I remember saying, "Johns Hopkins? What is Johns Hopkins?" I know. And so I quickly learned it was the premier medical school in the country. Now remember, this is also the same girl who had never had Chinese food or a bagel, so take it with a grain of salt. But off in my car, I followed his advice, came to interview here, was lucky enough to get an interview, and I've never left. It is a magical place, and that piece of advice from my pre-med years, just to this day, is one of my fondest moments.
These days, you wear a lot of hats around this hospital, but you remain a practicing internist. How often do you get to see patients these days, and do any of them recognize you as president of this place?
So I still see patients every week. On Mondays, I have my office hours, my clinic, and my patients have known me more than 20 years now. I'm a general internist, so by nature, I follow my patients over time, and I adore them. They are the best. I would have to say they all do know I'm the president of the hospital, and partially because I told them. I said, you have a choice. I'm going to see patients just this one day a week, and I'll work you in for emergencies, but I completely understand if you want to choose it. I'll help you find another physician. Almost all of them stayed, and they tell me to this day that they're my secret shoppers, and they will certainly provide me with feedback on anything around the hospital that they don't perceive as working well. So that's a perk for me of still having patients. But I don't think it's changed our relationship. They've known me, as I mentioned, for 20 years as Redonda Miller. They know how I practice medicine, and I'd like to say that it really hasn't changed. They know how to get a hold of me 24/7, and it's been really good to still practice.
As a follow-up question to that, are those long-term relationships part of the reason why you went into internal medicine?
They were. Some of the specialties I were considering at the time, it's tough. I liked everything. I did. Heart cardiology was high on the list, and I liked doing the catheterizations, but you often didn't see the patients then longitudinally. So you sort of have to make choices, but those longitudinal relationships, I know their kids, their grandkids, I know so much about them, and they know about me. It's very rewarding.
I'm sure you faced a lot of obstacles throughout your entire medical career. What are some of the challenges that you faced as someone who's juggling the roles of a doctor, a hospital president, and a mother?
Yes, the mother piece, yes. I'm not going to lie, it's tough to juggle different hats, and we all do it, and it's not just hospital administrators who have children. People have different priorities, different needs, different outside extenuating circumstances throughout their lives. You may have a sick parent you're caring for. You may have an individual passion, like maybe a marathon runner, and we can't lose sight, not just as hospital administrators, but all of us, no matter what careers we're in, that having some work-life balance is really key. And very, very important. So for me, right now at this part of my life, my priority, in addition to my work here, is my family. I have 2 little girls, and so you mentioned being a mother. I spend every minute outside of the hospital being a mother. That means organizing carpools or permission slips or buying clothes or being on the soccer field, whatever it means, and we just figure out how to make it work. I happen to marry an amazing man who is my equal partner and helps. I mean, he can do laundry, he can braid hair, he cooks, and we all share the responsibilities. So that's been very key. And then the other part of juggling this is we kid ourselves about having it all. And I've had women mentors who've told me, Redonda, you can have it all, but not at the same time, and that resonates. You may be focused on a career and a family right now, like I am. So I don't see a lot of movies. I think Seabiscuit from 25 years ago perhaps was the last non-animated film I've seen.
Non-animated film.
Yeah, non-animated. I please see plenty of animated. I don't read for pleasure like I would like to. I am not up on top of Game of Thrones, and it kills me. I love trash TV, but I just have not. So it's okay. For me, the joy that I get from helping my kid complete a school project or watching them struggle in a lacrosse game and learn how to get better, I do not want to miss the middle school talent show, and I'm not going to. And luckily, my colleagues understand, and I make sure they make it to their priorities as well. So it works.
Time after time, physicians at this hospital mention clinical excellence as an institutional value. What does clinical excellence mean to you?
Clinical excellence. I think the traditional notion of clinical excellence still rings true, meaning a surgeon who is top of his field as far as he or she, as far as clinical competency, skill in the OR. I think about the hematologist or the oncologist who is the best diagnostician and knows the top line, most innovative therapies for curing disease. And that is clinical excellence. It absolutely is. Here at Hopkins, though, clinical excellence, there's a different facet to it in my mind that is also equally important. And that is how you interact with your patients, how you explain diagnoses, how you treat people with kindness and compassion, how you pause to answer questions and be available. That the softer side of medicine, those softer skills that in my mind are equally important. Time and time again, I receive letters from patients, grateful patient letters, that describe how the entire care team, the doctors, the nurses, the respiratory therapists, the housekeeper that cleaned the room, took the extra minute to say hi, to ask if I had questions, to make my day just a little better. So in my mind, certainly the high level of competence and being top of your field is important, but also these other skills of really making sure we treat our patients as fellow humans. So that's clinical excellence. And I would like to say, I think we do a fine job here. We really do. I wish I could share with you at some point some of the letters I received. These patients, and they mention both. It's truly important.
You're also a founding editor for medical publications like the Johns Hopkins Internal Medicine Board Review. And it seems like it has a lot of comprehensive material for doctors who are studying for their board exams. In general, how do you think publications and writing tie together with medicine to educate doctors or the general public?
Well, I think that writing aspect is crucial. I do. And certainly, medicine, sometimes people will say, oh, you're going into medicine, you don't need to be able to write. Well, that's a fallacy. It doesn't matter what you choose to do in medicine. Even the day-to-day practice, writing is a component. It's practical. You have to communicate to your colleagues what your thinking is. I think this pulmonary nodule is lung cancer because blah, 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 blah. And you have to spell that out clearly in your medical notes. So there's this practical day-to-day communication that's important. What you're alluding to, though, is above and beyond that. At an academic medical institution like Hopkins, we faculty have to be able to teach, often in writing. We have to be able to disseminate our scientific discoveries. If you look at the root word of professor, it's profess, to teach. And part of that teaching is done in written form. So it's absolutely crucial that we be able to publish any innovation that we have, whether it's in the lab or on the wards. It's one thing to discover a great finding in the lab, but if no one else knows about it, it really loses its power. So writing is a form of dissemination, and dissemination is a part of making healthcare better. So it's crucial, absolutely crucial.
The Hopkins Hospital could not exist without the city of Baltimore. What are some of the current challenges to health in our city, and what are some of the most rewarding aspects of working with the Baltimore community?
I like how you phrased that the Johns Hopkins Hospital would not exist without the city of East Baltimore, and that is true. We were founded, the hospital, by Mr. Johns Hopkins, the wealthy merchant, who said you have two missions. One is to innovate and be a leader in scientific discovery and teach at the bedside, but the other is to be the community hospital for East Baltimore. So, when we look around, the challenges of East Baltimore are so many right now. Many of it has to do with disparities of care. We have here a local community that has suffered from high crime, high rates of substance use disorder, high levels of generational poverty. If you look at life expectancy here in East Baltimore, compared to some of the wealthier areas of the city, literally 2 or 3 miles away, 15 years difference in life expectancy. I mean, this is just not tolerable. So I think that's a big challenge. And Hopkins Hospital, in particular, is an anchor institution. We truly have a responsibility to play a role in changing that conversation, changing that landscape. So certainly we do all kinds of programs, as you can imagine, programs that go out into the community with community health workers to educate patients on diabetes and heart failure. We partner with religious organizations to be able to attend congregations and help teach about chronic diseases, or peer recovery specialists that we hire that help patients in the community with substance use disorder. But honestly, it has to be more than that. And this is where the partnership, you asked me, what are the rewards about working with the community? The rewards are going to a more granular level on how we can help, and partnering with our local community on what the needs are. It's easy for us to say, well, I think you need help with diabetes or hypertension or smoking cessation. We actually go out and do a community health needs assessment every 3 years, where we partner with religious organizations, with community leaders, elected officials, and we say, help us ask the community what their needs are. Surveys, focus groups, you name it. And here's what we hear. The needs of East Baltimore are jobs and training, safety, education, help with behavioral health. And you notice those are big needs. And without those social determinants, without fixing those, we're never going to make as much headway as we would like into helping with diabetes and heart failure. I mean, if you can't afford your insulin, how are you possibly going to control your diabetes? And why can't you afford your insulin? Access to training and jobs. So here at Hopkins, the rewards, the opportunities are just so immense. We've really partnered with these community organizations to launch numerous training and jobs programs. We have a program with Dunbar High School, Baltimore City Community College, and here, where it's a 6-year program, we take people through a high school degree, a community college degree, and a job with direct training in our walls to become radiation techs or anesthesia techs. We hire returning citizens. So citizens who come out of prison, they have to check a box, I've committed a felony, they can't even get a job interview. We work with a community organization, Turnaround Tuesday, who helps prepare them, helps them be job ready. They call us, we hire them into entry-level positions. And then we have coaches that help them move up the ladder and help them go back to school and maybe get a college degree and move up the ranks into higher positions in the organization. And that's just a little sampling of many, many programs we're doing to really provide that education and training that our community needs so that they can thrive.
Just looking around this room, we see portraits of Hopkins Hospital presidents who came before you. As the first female president of the Johns Hopkins Hospital, does the element of not knowing what comes next still apply to you today?
It does, absolutely. That hands down, the idea of not knowing what comes next pretty much applies on a daily basis. As you guys have noticed, healthcare is not a stagnant environment. It is changing by the minute. The emphasis on value over volume, different payer models. So from my day-to-day work, I have to pivot constantly on what new programs do we need to launch? How can we make healthcare better? How do we move our organization from a focus on fee-for-service and the more we do, the better, to what outcomes are really important? If you look at a surgery we do, is it important to know how the patient did 3 and 4 weeks out? Are they back to ambulating? Are they thriving? Those long-term outcomes are so much more important, more than just did we get them through the 3 days of surgery here. So we're really trying to emphasize how we shift from volume to value. But healthcare is changing just in so many ways, just across the board. Different, should we have Medicare for all or not? How do we make sure that as an institution we're not focusing too narrowly? And as I alluded to a few minutes ago, attacking the social determinants of health from a much broader perspective. At the same time, how do we make sure we don't lose that cutting edge mission to be world leaders in the next cures for tomorrow? That's part of us that we just can never lose. And that comes with a price, right? Innovation and research is not cheap. And so how do we be high value, but at the same time not lose our academic mission? So the opportunities are immense and changing constantly. So yes, I have no idea what's going to come next. Personally, from my own career, I don't try to plan too far out. I love my job right now. It is the best job in healthcare, I will tell you. It really is. Being affiliated with such a high quality organization and the people who walk the halls, it's really impressive.
Finally, Dr. Miller, do you have any advice for students who are looking to go into medicine?
Oh, I do. You know, I think the advice for those going into medicine probably is generic advice for many different fields, but here's what I would say. You know, just keep an open mind. There are lots of different careers in medicine. Find your passion. That's the most important thing about what you choose to do, and then go after it with great energy, and remember to be kind to everyone. And I think those are the secrets to success in any field. Open mind, find your passion, work hard, and be nice.